have talked a lot about auditory system. In your practical classes, you have known how to examine the vestibulocochlear nerve. Okay, how to examine vestibulocochlear nerve. You know everything about Rennie's test, Weber test, how to differentiate between a sensory neural deafness and conductive deafness, right? So everything you have taught there. You have been taught there, right? And we are here to discuss about the physiology of auditory system. We are not going into the details of the anatomy, okay? So we had started, a brief recap, we had started with the physical properties of sound. So sound is a mechanical wave that needs a medium, and it transmits from one place to another by alternate condensation and rarefaction. So say for example, if sound is transmitted within the air, so air molecule will alternatively condensed and there will be rarefaction, right? Okay, so sound wave is basically a pressure wave. We can assume sound wave as a pressure wave, and obviously as a pressure wave we can calculate the sound loudness or the intensity of sound in the unit of dyne per centimeter square, which is an unit of pressure, right? But it is very difficult as there is numerical fractions, right? Decimal fractions. So that is why we have assumed logarithmic way of expressing sound intensity, and that is called decibel. So intensity of sound we measured in the unit of decibel, and frequency of sound we measure it in Hertz, right? Okay, and we have a reference sound pressure level. That reference sound pressure level is 0.30204 dyne per centimeter square, and we express any sound in the logarithmic way, that is how much multiplication of this reference sound, how much times of this reference sound, okay? So sound pressure level, the formula is 20 log test sound pressure divided by reference sound pressure. We had discussed yesterday, right? Okay, now the auditory pathway we have discussed, okay, how auditory nerve, that is the cochlear nerve, enters into your auditory cortex. So the pathway you must remember, and that is very frequently asked in your viva examination. And we have discussed the mnemonic echolemma, right? We are not going into details. And next we have discussed the function of middle ear. We have told that middle ear, very important question, for very important short note in your first professional MBBS examination. So we have told that at air-water interface, when sound transmits from air to water, so there is loss of decibel. That means if someone calls from air and someone is inside the water, so sound will be lost by 30 decibel. Okay, so if I call from outside in the air at a 40 decibel intensity, someone inside the air will listen at 10 decibel. So 30 decibel will be lost at air-water interface, right? So this 30 decibel loss at the air-water interface or air-liquid interface, it is efficiently compensated by your middle ear. So middle ear is basically acting as an impedance matching device. Your middle ear is acting as an impedance matching device. What is impedance? It is the resistance of the molecule of a medium against vibration. Okay, so when sound passes in the air molecules vibrate, right? And the resistance against this vibration is called the impedance. And you know impedance of water is far more higher than air, right? Okay, so that is why the intensity of sound is lost at the air-water interface. So similarly, if you see our design of ear, so here is the external auditory canal and here is the middle ear, and then we have endolymph and perilymph, right? So sound is being transmitted in air in your external auditory canal, and it strikes on the tympanic membrane. And inner ear you have liquid, that is endolymph and perilymph, right, in the inner ear. So that is why in the air-water interface or air-liquid interface, here air-perilymph interface, right, sound intensity is lost by 30 decibel, okay? And your middle ear compensates this 30 decibel by various ways. So number one way is the tympanic membrane oval window ratio, which is 20 times. Second is the lever action of the ossicular chain. Here is the lever action. So the fulcrum of this lever lies between the malleus and incus, right? So this lever action compensates for twice. Yes, this lever action it increases or multiplies the sound pressure level by 1.3 times, and finally the buckling effect or elastic effect of the tympanic membrane, it multiplies the sound by 2, right? And finally you have this 20 log 20 plus 20 log 1.3 plus 20 log 2, that is 30 decibel. So exactly 30 decibel were being lost at air-water interface, and your middle ear, which is very essential in amplifying sound intensity, your middle ear just compensates this 30 decibel. As a result, there is no loss of sound intensity when sound wave passes from external auditory canal to inner ear, although inner ear contains liquid, which is endolymph and perilymph, right? Okay. So your first answer will be, what is the function of middle ear, major function of middle ear? Your first answer will be, middle ear acts as an impedance matching device between air and perilymph, right? Okay. So next we have talked about depolarization of hair cell. So you know, sound wave is a mechanical energy, okay, and your auditory cortex do not understand any mechanical energy. It understands only electrical energy. So this sound wave has to be converted into depolarization or action potential, and it has to be transmitted through your auditory nerve and go to your auditory cortex so that you can feel the sound. Okay, like any other sensation, touch, pain, temperature, vibration, proprioception. So all these sensations you have learned in sensory system. Similarly, sound is also a sensation. It is a special sense, right? Sound is also a sensation. So like any other sensation, be it touch, pain, temperature, vibration, or whatever, like any other sensation, this different types of energies has to be converted into depolarization or action potential so that you can sense that in your auditory cortex. Now, next long question for your first professional MBBS is depolarization of hair cell, or it may come in a different way, but the answer will be same, right? How sound energy is converted into electrical energy, okay? How sound energy is converted into action potential. Answer is same, but the question may be asked in different ways. It may be depolarization of hair cell, it may be how sound energy is converted into electrical energy, it may be how sound energy is converted into action potential in auditory nerve. In various ways the question may be asked, but your answer will be same, right? Okay. So depolarization, during talking about depolarization, we have talked that the structure of inner ear, okay? The structure of inner ear is much important over here, okay? So, yes, so this is the structure of inner ear. It is a snail-like structure, and you see here is the cochlea and here is the vestibular system. We have not talked about vestibular system. It will take a different class, right? And here is the cochlea, and you see there is a turn, okay? There is a turn. There are 2.5 turns, RI patch, right? So if you remove this, if you remove this turn and see this in a linear fashion, you get this, okay? So here is your external auditory canal, and sound transmits over here and it strikes on the tympanic membrane. Tympanic membrane is attached to malleus, here is incus, and then stapes. Stapes is connected to oval window through into the chamber scala vestibuli, right? Scala vestibuli, it contains perilymph, scala media, it contains endolymph, and scala tympani, it contains perilymph, okay? And remember, this scala vestibuli and scala tympani, these are connected through a foramen. So once pressure inside the scala vestibuli changes, pressure in the scala tympani also changes, right? Okay, and this membrane between scala media and scala tympani, the lower membrane is called basilar membrane, and this upper membrane is called the Reisner's membrane, okay? And the rule is, when this basilar membrane convexed upwards or bows upwards, there is depolarization of the hair cell. And when basilar membrane, so everything is on the movement of basilar membrane, okay? The whole process of depolarization, it depends on the shape of basilar membrane. Once basilar membrane moves upwards, there is depolarization of the hair cell. Once basilar membrane comes downwards, there is repolarization of hair cells, okay? This is a structure of the hair cell, and first see the location of the hair cells, okay? So here is the thing, the cross section of the cochlea. We have done a cross section of the cochlea. The cochlea tube, if we do a transverse section, we see inside there are 3 tubes, okay? So scala vestibuli, scala media, and scala tympani, there are 3 tubes, and here is the basilar membrane. Over the basilar membrane lies the hair cells, okay? Over the basilar membrane lies the hair cells. We have also talked about hair cell. We are born with few millions of hair cells, and gradually with the age process, with the aging process, we lose hair cell. Okay, so there is some age-related degeneration of the hair cells. Okay, it is age-related hearing loss. Okay, you will see some old individual having difficulty in hearing, so that is age-related hearing loss. But these hair cells are also lost in sound exposure. Okay, these hair cells are also lost in sound exposure, that is noise-induced hearing loss, the specific loss of hair cell. Normal hair cell loss is in a particular pace, but if this rate of destruction of hair cell is increased, okay, so what happens in factory workers or aircraft workers, so it happens noise-induced hearing loss. Okay, so we need to have protection, earplugs or something like that. Okay, so hair cells lies over this basilar membrane. Okay, hair cells lies on this basilar membrane, and hair cells are of two types. One is outer hair cell or OHC, and another is inner hair cell or IHC. So you see outer hair cell and inner hair cell, and over the hair cell it is the tectorial membrane, and here is the basilar membrane. And the rule is always when the basilar membrane moves upwards, there is depolarization of the hair cell. Once the basilar membrane moves downwards, there is repolarization of the hair cells. So first see the structure of the outer hair cells. These are outer hair cells. All the hair cells are ciliated. They have cilia of different lengths. Okay, shorter cilia, longer cilia, and gradually the length of the cilia increases. You see, gradually length of the cilia increases. This is a diagrammatic picture. So we have drawn only 3 cilia, but there are numerous cilia, and gradually the length of the cilia increases. Okay, for outer hair cells, the cilia are embedded in the tectorial membrane. Okay, for outer hair cells, the cilia are embedded in the tectorial membrane, but if you see inner hair cells, the cilia are free. They are not embedded in the tectorial membrane, right? Okay, now see how basilar membrane moves upwards. For the students who didn't attend yesterday's class, so sound wave first strikes on the tympanic membrane. This is the first event. Okay, sound wave strikes the tympanic membrane. So tympanic membrane sometimes moves outwards, sometimes moves inwards. This is because sound wave transmits in air with alternate condensation and rarefaction. Okay, alternate condensation and rarefaction. So if sound wave strikes on the tympanic membrane, and adjacent to tympanic membrane there is condensation of the air molecules, right? So tympanic membrane will move inwards. Okay, so once tympanic membrane moves inwards, and there is a hinge or fulcrum here between malleus and incus in the middle ear. So fulcrum is here between malleus and incus. So see the fulcrum over here. So fulcrum is here in the junction between malleus and incus. So if tympanic membrane moves inwards, oval window moves outwards, that is stapes moves outwards, right? So due to this lever action, okay. Now tympanic membrane moves inwards and stapes moves outwards. So once stapes moves outwards, it takes oval window along with it. So there is a vacuum or negative pressure inside this cala vestibuli. Negative pressure inside this cala vestibuli. This is the hallmark, negative pressure in this cala vestibuli. Once there is negative pressure in this cala vestibuli, this negative pressure is transmitted here in this scala tympani, because scala vestibuli and scala tympani are connected to each other through a foramen, right? So scala vestibuli, negative pressure, scala tympani, negative pressure. Okay. So once there is negative pressure in this scala tympani, the round window, it is sucked inside. Round window, it is sucked inside this scala tympani. Round window is sucked inside this scala tympani, and round window makes a push over the basilar membrane, so that basilar membrane moves upwards. Okay, so basilar membrane moves upwards. Now come to this picture. Basilar membrane is moved upwards. Okay, so once basilar membrane moves upwards, there is a shearing force over the cilia. There is a shearing force over the cilia, and shorter cilia are moved towards the taller cilia. Shorter cilia are moved towards the taller cilia. Okay, so if my little finger is a shorter cilia and my index finger is a taller cilia, right? So the movement will be like this. Okay, so shorter cilia will move towards the taller cilia. Okay, now what will happen once shorter cilia will move towards the taller cilia? Okay, now see a particular hair cell over here. Okay, So this is a shorter cilia and these two are taller cilia. Shorter cilia will move towards the taller cilia. Okay. So normally if we see a hair cell microscopically if we see a hair cell, okay, on the cilia of the hair cell there are potassium channels. Okay, there are potassium channels, and we have till now we have studied different types of potassium channel, and particularly voltage gated potassium channel. The potassium channels which opens up due to increase in voltage, or at a particular voltage the potassium channels are opened up, right? But here the potassium channels have no relation with the voltage. Okay, these potassium channels are mechanosensitive potassium channels. Okay, these potassium channels are mechanosensitive or stretch sensitive potassium channels, and these are called TRP channels. Okay, transient receptor potential channel, TRP channels, right? Okay, so once shorter cilia moves towards the taller cilia, once this happens, okay, there is a stretch on these tip links. What are the tip links? These are connecting bands. These are connecting bands between the cilia, and they are also connected to the potassium channels. Okay, so there is stretching of these potassium channels, and these potassium channels opened up. Normally when sound is not present, normally when environment is silent, sound is not present, these potassium channels are partially opened. These potassium channels are partially opened, and some amount of potassium enters into the hair cell through these topmost potassium channels, and some potassium leaks through the base of these hair cells. This is the normal event, normal when sound is not present, okay, in a silent environment. But when sound is present, when there is initiation of sound, so the shorter cilia will move towards the taller cilia, and the tip links are stretched so that potassium enters into the hair cell through the mechanosensitive potassium channel, and this is very rapid, very high amount of potassium enters large amount of potassium enters into the hair cell, and this makes depolarization of the hair cells. This makes depolarization of the hair cell, and in case of inner hair cell, due to this depolarization, calcium enters into the cell, and there is exocytosis of these vesicles contains glutamate. Okay, and you know glutamate is a neurotransmitter. Okay, and inner hair cells are connected to vestibulocochlear nerve, not vestibulocochlear, cochlear nerve. Inner hair cells are connected to cochlear nerve. Okay, and there is generation of action potential in the cochlear nerve, right? Generation of action potential in the cochlear nerve. But remember, action potential never generates in hair cell. Okay, in hair cells there is only depolarization, but once glutamate is released in the hair cell and cochlear nerve junction, action potential happens in the cochlear nerve, right? So, see this picture. Okay, so we talked about upward movement of basilar membrane, right? Upward movement of the basilar membrane and change in membrane potential of the outer hair cell. Okay, so what happens to the inner hair cell? Okay, what happens to the inner hair cell? Actually, inner hair cells are connected to your auditory nerve, not the outer hair cells. Outer hair cells are free. Okay, the movement of cilia, shorter cilia to taller cilia, this ciliary movement happens in inner hair cells also, but this is due to fluid movement. This is not due to upward displacement of basilar membrane, right? And it is only the inner hair cell which is connected to auditory nerve that takes the signal to your auditory cortex. Okay, inner hair cell are connected to auditory nerve, not the outer hair cell. Okay, now comes the next question, then what is the function of outer hair cell? Tale outer hair cell ki korche? Depolarization is happening in both outer hair cell and inner hair cell. Okay, depolarization is happening both outer hair cell and inner hair cell, but your auditory nerve is only connected to inner hair cell, not the outer hair cell. Then what is the function of outer hair cell? Okay, it comes as the next question, what is the function of outer hair cell? What is the function of outer hair cell? Outer hair cell. Okay, so question is, so we are making presentations in question and answer fashion, right? Okay, so function of outer hair cell. Number one function, it amplifies sound and clarity of sound. যদি কারোর আউটার হেয়ার সেল নষ্ট হয়ে যায় তাহলে সাউন্ড ক্লিয়ার হবে না, নয়েজি হবে, right? যদি কারোর আউটার হেয়ার সেল, there are different types of diseases that you will study in final year ENT or maybe in third year ENT. Okay, so function of outer hair cell is amplify sound and to increase the clarity of sound. Okay, amplify sound and to increase the clarity of sound. So how your outer hair cell does that? Okay, by reducing background noise. Okay, noise cancellation. ইয়ারফোনে হয়তো নয়েজ ক্যান্সেলেশন ফিচার থাকে, রাইট, ইয়ারবাডসে। সো ইয়োর নয়েজ ক্যান্সেলেশন ফিচার কে করে? ওটা আউটার হেয়ার সেল করে, রাইট? নর্মালি নয়েজ ক্যান্সেলেশন করে আউটার হেয়ার সেল অ্যান্ড ইট ইনক্রিজ দ্য ক্ল্যারিটি। সো হাউ ডাজ ইট ডু দ্যাট? Outer hair cell rests on the flexible part of basilar membrane. So you see this picture, that will be clear. Okay, so these outer hair cells, these are outer hair cells that rest on the flexible part of basilar membrane. Okay, flexible part of basilar membrane. So when there is depolarization of outer hair cell, when there is depolarization of the outer hair cell, something strange happens to the outer hair cell. Okay, outer hair cell has got a particular protein called the prestin protein, prestin, P-R-E-S-T-I-N, prestin protein, which maintains the length of the outer hair cell. Okay, this length of the outer hair cell, this matters a lot for noise cancellation, right? So this length of the outer hair cell, it matters, and the length of the outer hair cell, it depends on the prestin protein. Okay, so these are prestin protein of outer hair cell. Okay, so outer hair cell during hyperpolarization. So these prestin proteins are arranged vertically. These prestin proteins are arranged vertically during hyperpolarization. And when these prestin proteins are depolarized, when this outer hair cell is depolarized due to potassium entry, right? When outer hair cells are depolarized due to potassium entry, there is rearrangement of this prestin protein from vertical fashion to horizontal fashion. Okay, in a stack-like fashion, and it makes the outer hair cell shorter. Okay, it makes the outer hair cell shorter. Okay, outer hair cell গুলোর লেন্থটা ছোট হয়ে গেল। Okay, because of depolarization, because depolarization causes rearrangement of these prestin proteins, which are normally arranged in a vertical fashion. Due to depolarization, they makes a rearrangement, a self rearrangement, and it causes the prestin proteins in a horizontal fashion, in a stack like fashion, right? So what happens due to that? So once the length of outer hair cell shortens, because you see the outer hair cells are connected to tectorial membrane by the cilia, which is fixed. Okay, so once the outer hair cell shortens, it takes the basilar membrane, flexible part of basilar membrane along with it, right? So once the basilar your outer hair cell shortens, it takes the basilar membrane upwards. Okay, because basilar membrane is flexible, but not the tectorial membrane. And you know, the cilia of outer hair cells are attached to tectorial membrane. So it cannot pull the tectorial membrane downwards. It instead pull the basilar membrane upwards. And you know, when there is depolarization, when there is bowing upwards of basilar membrane, it causes depolarization. So this depolarization is further enhanced by shortening of outer hair cell, which takes the basilar membrane upwards. Okay, so it increases the bowing up of basilar membrane upwards and further enhancement in the action potential in the auditory nerve. Getting my points? So this is how your outer hair cell amplifies sound and makes a noise cancellation. Okay, so function of outer hair cell is to amplify sound and increase the clarity of sound by reducing background noise. Okay, and it switches between the louder sound. Okay, switches between the louder sound and mild sound. Now next question, what is endocochlear potential? What is endocochlear potential? So if you see this picture, here is the basilar membrane, and the top of the basilar membrane, here is the hair cell. Okay, and the resting membrane potential when sound is not present, When sound is not present, the resting membrane potential of this cell, which is a hair cell, okay. So inside the hair cell, resting membrane potential is minus 60 millivolt, and in this scala media, due to plenty of potassium ions inside, the potential over here in the scala media is plus 80 millivolt. Okay, the potential over here in this scala media is plus 80 millivolt. Okay, plus 80 millivolt. So as a result, the potential difference between a hair cell and scala media is 140 millivolt. Okay, 140 millivolt, and this is called endocochlear potential. Okay, this potential is called endocochlear potential. So you see potential difference across the hair cell in cochlea. In cochlea, endocochlear potential difference is 80 plus 60, that is 140 millivolt. Resting membrane potential of cochlear hair cell is minus 60 millivolt, and endolymph potential in scala media is plus 80 millivolt due to plenty of potassium ions. And in vestibular organ, ভেস্টিবুলার সিস্টেম আমরা এখনো পড়াইনি। সিমিলারলি এরকম হেয়ার সেল যেগুলো আমরা ককলিয়াতে দেখতে পাচ্ছি, একই রকমের হেয়ার সেল আমাদের ভেস্টিবুলার সিস্টেমের মধ্যেও আছে। ককলিয়ার সিস্টেম যেরকম অডিটারি পার্টের মধ্যে আছে, সেরকম ভেস্টিবুলার পার্টের মধ্যেও প্রচুর হেয়ার সেলস আছে। ওকে, অ্যান্ড ইন দ্যাট কেস উই কল ইজ এন্ডোভেস্টিবুলার পোটেনশিয়াল, অ্যান্ড এন্ডোভেস্টিবুলার পোটেনশিয়াল ইজ 40 millivolt, around 40 millivolt. We will further discuss while discussing the vestibular system, but auditory system is much more important for your examination purpose. Very frequently it comes in the examination, particularly the function of the middle ear, then how depolarization takes place in the hair cell, or how sound energy is converted to action potential, or how sound energy is converted to electrical energy. Okay, this is the most important domain here. Okay. Also you have some MCQs in NEET PG from this segment. Okay, so this is how this is what is endocochlear potential. Now next question is, what is cochlear microphonics? What is cochlear microphonics? Okay. Okay, these are short questions, may be asked in the viva, but not very much important for your theory purpose, right? So what is cochlear? For your theory purpose, two most important questions is function of the middle ear and depolarization in hair cell. Okay, these two are most important for your theory examination. Okay, depolarization of the hair cell, number one, depolarization of the hair cell, and function of middle ear, function of middle ear. Okay, these two are most important for your theory purpose. Okay, now next question is, what is cochlear microphonics? You have already known the structure of a hair cell. There are various lanes of cilia, and on the top of the cilia you have mechanosensitive potassium channels, and these potassium channels are interlinked by a fibrous band called the tip links, and here is the hair cell body, and at the base of the hair cell you have a potassium leak channel and also calcium entry channel. Okay, and in the inner hair cell you have specifically glutamate vesicles, the vesicles which contains glutamates, and when the cell will be depolarized, this glutamate will be released in the hair cell and nerve junction, right? Okay, so there are few clinical implications as well, as we have told that your middle ear is functioning as an impedance matching device, and it compensates the exact 30 decibel of sound which is supposed to be lost at air-water interface, right? So say for example someone, a patient with middle ear disease, someone having otitis media, someone having ossicular chain disruption, or someone having defect in the tympanic membrane, right? Defect or a hole in the tympanic membrane. So there are lots of diseases you will study in your ENT, right? So any disease which affects the middle ear, it decreases the intensity of sound with which you hear, right? Okay, so any disease of the middle ear will cause 30 decibel loss of sound depending on the severity of the disease, right? Okay, so it is a type of, what type of deafness? Conductive deafness or sensory neural deafness? If there is any disease or problem in the middle ear, what type of deafness is this? Yes, conductive deafness. It is conductive deafness. Okay, also wax in the auditory canal. Okay, wax in the auditory canal, it is a type of, what type of deafness? Conductive deafness. Okay, if a patient who had worked in a aircraft manufacturing factory for a long period of time and having less number of hair cell and is having very difficulty in hearing, what type of hearing loss is this? Sensory neural deafness, right? So getting the points, how conductive deafness and sensory neural deafness takes place. So when hair cells are damaged and further nerves are damaged, we call it sensory neural deafness. When there is a problem in the external auditory canal like wax, when there is any problem in the malleus incus stipis or ossicular chain disruption, any fluid accumulation in the middle ear cavity, right? There is otitis media, infection in the middle ear cavity. So all these will be under conductive deafness, right? Clear? And once there is conductive deafness, if it is in the middle ear, there will be 30 decibel loss of sound, depending on the severity of the disease, right? Yes. Now another clinical implication is the ciliary dysfunction. There are a number of diseases, particularly genetic syndromes, where the ciliary movement is lost. We have talked about this yesterday, which is called Carter-Jenner syndrome. Okay, Carter-Jenner syndrome. So these patients are having problem in the movement of cilia, and you know, in ear, in the auditory system, ciliary movement is everything. Once the ciliary movement is lost, because the main thing, the main hallmark of hearing mechanism is the movement of shorter cilia towards the taller cilia. Okay, so shorter cilia will move the taller cilia. This movement is very important, and it is controlled by a particular myosin protein, right? So when this ciliary movement is lost, okay, patient will not be able to hear. Okay, so this is a hair cell defect. Okay, this is also a sensory neural deafness, right? Okay, so ciliary movement, what are the places where ciliary movement is important? So number one, this ciliary movement in the hair cell. Okay, number two, sperm motility, sperm movement, it is also important. And in our respiratory tract, ciliary movement is important. Okay, where ciliary movement protects you from entry of dust, from entry of germs, right? So ciliary movement is very important, particularly in three places: in your respiratory tract for the sperm movement, okay, and also in ear for your hearing. So these patients having ciliary motility dysfunction, they have hearing loss, number one. Okay, they will have no sperm movement, and also they will have frequent respiratory infection. Okay, so we call it Carter-Jenner syndrome. Okay, you will study further about this syndrome in your medicine classes or ENT. Okay, so now comes another thing that is called cochlear microphonics. So what is cochlear microphonics? So I told that the potassium channels on the top of the cilia, these potassium channels are TRP channels, TRP potassium channels. Okay, these potassium channels are not actually fully closed when sound is not present. In a silent environment also, these potassium channels are partially opened, কিছুটা খোলা থাকে, right? And some amount of potassium enters through the cilia and exit through the leak channel at the base, leak potassium channel at the base of the hair cell. Okay, so due to this there is slight current flow. Due to this there is slight current flow in the hair cell, but it cannot be recorded from the outside. Okay, but when a slight sound is present, when sound starts, just sound starts, okay, there is opening of this mechanosensitive potassium channel, and in a large amount of potassium enters into the hair cell, and this large amount of potassium while enters into the hair cell, it can be recorded from outside, okay, by a device. It can be recorded outside. It is a hearing test only, a sophisticated hearing test. Okay, large amount of potassium enters into the hair cell, and this can be recorded by a particular machine, and this event is called cochlear microphonics. Okay, this event is called cochlear microphonics. It is a testing of sensory neural component of hearing. Okay, cochlear microphonics. Okay, now localization of sound. Okay, কখনো দেখেছো যে তোমাকে কেউ ডাকলো, পেছন থেকে ডাকলো, তুমি এদিকে তাকালে, মানে তুমি বুঝতে পারছো না যে সাউন্ডটা কোথা থেকে আসছে, ঠিক আছে? সো উই হ্যাভ এ লোকালাইজেশন। ওকে, তো লোকালাইজেশনের প্রবলেম হয় অনেক সময়, অনেক পেশেন্টের সাউন্ড লোকালাইজেশনের প্রবলেম হয়। সো উই আন্ডারস্ট্যান্ড কি সাউন্ডটা কোথা থেকে আসছে, দ্য সোর্স অফ দ্য সাউন্ড, রাইট? দ্য সোর্স অফ দ্য সাউন্ড উই ক্যান ডিটারমাইন কি আমাকে কোন জায়গা থেকে ডাকছে, ওদিক থেকে ডাকছে না এদিক থেকে ডাকছে। ওকে, আমাকে যেদিক থেকে ডাকে আমি সেদিকেই তাকাই, তাই তো? সো উই হ্যাভ এ লোকালাইজেশন অফ সাউন্ড, and how this localization takes place. Okay, how sound is localized in human ear. Okay, how sound is localized in human ear. So it has a rule: below 3000 frequency, below 3000 Hertz frequency, and above 3000 Hertz frequency. Okay. Just remember, not a big detail is required in this regard, right? So below 3000 Hertz, it is the time differences as little as 20 microsecond, and above 3000 Hertz by loudness difference. And major function is also played by your pinna. Okay, your pinna, this external ear. Okay, your pinna, it is directed in such a fashion that you can direct or you can localize the sound. Okay. So below 3000 Hertz by phase difference, and above 3000 Hertz by loudness difference. Now, frequency coding. Frequency coding means, do you know how much frequency we hear? Every sound we cannot hear. Below 20 Hertz we cannot hear. Above 20,000 we cannot hear. So our hearing range is 20 Hertz to 20,000 Hertz. Okay, this is our hearing range. 20 Hertz to 20,000 Hertz. Okay. Above 20,000 Hertz we cannot hear. So there is a range or capacity of human ear. Now a frequency আমরা কি করে বুঝতে পারি যে কোনো sound which is having low frequency and any sound which is having high frequency. How to differentiate between a low frequency sound and high frequency sound. Okay. Not very important for you for theory purpose, but maybe asked in the Viva examination. So 20 Hertz to 1000 or 2000 Hertz, we have three things that is called phase locking and Wally effect. Okay. 2000 to 5000 Hertz we have frequency theory, and 5000 to 20,000 Hertz we call it place theory. So you see the most important is 5000 to 20,000 Hertz because the range is high. 5000 থেকে 20,000. So এতটা রেঞ্জের মধ্যে we can differentiate the frequency of sound by place theory. Okay, we can differentiate it by place theory. So what is place theory? So place theory is on the basilar membrane. যখন higher frequency হয়, so we told that the basilar membrane is the important structure in your inner ear, and when basilar membrane moves upwards, okay, basilar membrane moves upwards, it causes depolarization and it creates action potential in your auditory nerve, right? And this basilar membrane is a very flexible part. Okay, very flexible part. It has got a base and it has got a apex. Okay, it has got a base and apex. So when the base of the basilar membrane moves upwards, it detects the high frequency sound, and when the apex of the basilar membrane moves upwards, it detects the low frequency sounds. Okay, so on the basilar membrane, higher frequency waves stimulate the organ of corti near the base of the cochlea, and low frequency sound stimulate the hair cell near the apex of the cochlea. Okay, next is frequency theory. What is frequency theory? Frequency theory is it tells that your auditory nerve is not a single nerve. So there is lots of nerve fiber. The collection is auditory nerve. Okay, it says that for a particular frequency you have a group of neurons. Okay, for a particular frequency, 20 Hertz এর জন্য কিছু 5000 Hertz এর জন্য কিছু নিউরন আছে, 3000 Hertz এর জন্য কিছু নিউরন আছে. So neurons are different to detect different frequency of sound. Okay, so this is frequency theory. And phase locking is one afferent nerve for every point of the phase. তো সাউন্ড ওয়েভের ফেজটা কীরকম হয়, একটা সাইন ওয়েভের মতো. সাইন ওয়েভ জানো তো, ইউ হ্যাভ নন ফ্রম ফিজিক্স নলেজ. ওকে, সো for every point there is a single nerve, and Wally effect is for one full cycle there is one single nerve, right? So the thing is 20 Hertz থেকে 2000 Hertz of the phase locking and Wally effect, these two are applicable. 2000 Hertz থেকে 5000 Hertz frequency theory, that means for each frequency there is a group of nerve, and 5000 Hertz to 20,000 Hertz is the most important part, which codes for the place theory. Okay, it tells that your basilar membrane is flexible. When high frequency, to detect high frequency sound, the base of your basilar membrane moves upwards, and to detect low frequency sound, the apex of your basilar membrane moves upward. Frequency coding, or this is how we can identify different frequencies of sound between 20 Hertz to 20,000 Hertz, which is the normal audible range. Okay, amplitude coding. এটা তো জাস্ট একটা সিঙ্গেল পয়েন্ট. বেশি অ্যামপ্লিটিউড আমরা কি করে বুঝতে পারি, যে মানে কম আস্তে সাউন্ড বা খুব জোরে সাউন্ড. ওকে, ডেসিবেল আস্তে আস্তে বাড়ছে. সো দ্য মোর ইজ দ্য ডেসিবেল, দ্য মোর ইজ দ্য লাউডনেস অফ দ্য সাউন্ড, দ্য মোর উইল বি দি জেনারেশন অফ অ্যাকশন পোটেনশিয়াল ইন অডিটরি নার্ভ. ইট ইজ ভেরি সিম্পল. As simple as that. Thank you.